I'm Michael Shea in Arlington County.
And I'm Sue Mosher.
Thank you for joining us. This is
Behind the Mask.
So Sue, what has the COVID experience been like for you and your family here in Arlington?
We have been so glad to be in a community where there was a neighborly spirit, where we had organizations, government, non-government, businesses trying to make it all work, make the unpredictable feel less burdensome. We did change our ideas about how we want to live. We found that being in the backyard or looking out on the backyard was really important to us, and we've had a little bit different feel about just being in this place. We really like it. We've been here for a while, and we're glad we were here rather than any number of other places where we could have been during the pandemic.
You're exactly right that Arlington has a lot of resources to deal with the pandemic. And I agree with you about finding new things to like. My family and I had never done a lot in terms of bringing restaurant food home or having it delivered, except maybe a pizza. And we found that we really enjoyed that, bringing the restaurant food home and eating it in our dining room. But what are some of the ways that you think Arlington has done well in confronting the pandemic?
I have heard so many people say that they felt that the COVID vaccine clinics that the county put on were the public health department's finest hour, and I have to agree with that. I did do some volunteering at the clinics through the Virginia Medical Reserve Corps, and it was one of the best experiences of the pandemic to spend a day. I was trying to spend one day a week at the peak of things for about 3 months, and just seeing people come in and get their anxieties, softened, cooled, get their needs met competently, but more than competently, it was really a caring environment, and not just by the volunteers, who you would kind of expect that because they're giving their time, but also the county staff, the contractors. Everyone was always thinking, how can we do this better? Every time I came in on a Monday, by the end of the day, my lead or the site director would come through and ask, well, how did things go today? How could we do it better? And then I'd come in the next week and things would have changed just that little bit to move people through the line faster, or have better signage, or if there's a place where people are going to kind of be in line for a few extra minutes, have something funny there, have something that's going to put people at ease. And that was what it was really all about. Because so many people came through those clinics really at the time when people were stressing a lot about, when can I get the vaccine? When can my my elderly mother, get the vaccine? When can my son, who has a medical condition, get the vaccine? That was a really stressful period for many people. And to see the friendliness and the compassion of everybody who was involved was amazing. The nurses especially were incredible. And some of them, you knew if you had a child who seemed a little bit nervous, you could send them to this nurse because she had some toys and she had just a way of talking. But they were all fabulous. They all just did an amazing job under very stressful conditions. And our county staff being able to set up these clinics on a moment's notice, and then as they started to take them mobile to different one-day locations. That's where I think it really made a difference, is getting out in the community, not just waiting for people to come to the big clinics, but also getting them out there, partnering with people like Neighborhood Health, partnering with people like Ebenezer Baptist Church to get the clinics out where the people are.
And are there some areas where you think Arlington could have and should have done better?
When this happens again, and we really can expect it, we have to be thinking that way, I would hope that the needs of workers would be taken into account more. The system that was set up to handle employer-eligible vaccinations was not very effective. I know companies who were desperate to get their employees vaccinated and followed all the steps and never heard anything. And there were also individuals who really needed support, people like home health care workers who were not working for a big agency or a hospital, but they were private hire. It was not easy to get them into the vaccination pipeline, but once they did, they were good to go. So that's where I would like to see a little bit of thought given. How do we handle the needs of the grocery workers, the restaurant workers who really were essential to our well-being, keeping us well-fed and healthy during the pandemic. The Uber drivers, how many people got Uber Eats and other deliveries. Those people, getting them into a vaccination pipeline, making sure they have testing and medical care if they need it, that would be really important.
Well, Sue, I want to thank you for your commitment to your community. I know from your hard work and your perseverance that you've become a reliable source of good information on social media, and I thank you for all of that.
And that's what we want for all of us. Stay healthy, follow the best recommendations you can find, talk to your doctor, and continue to support your neighbors. It takes a village.